listening to the Inspire Excellence podcast, recorded at the BVA headquarters with your hosts, Bill Whitaker and Tommy Alquist. Bill is the former CEO of the J.R. Simplot Company and is now a full-time adventure seeker and philanthropist. Tommy is the CEO of BVA Development, co-founder of Crush The Curve Idaho, and most importantly, a full-time grandfather. Each episode focuses on sharing the stories of individuals who are changing the world.
Welcome back to Inspire Excellence podcast. This week we have a great guest, and looking forward to getting caught up with Bill. I do want to start this episode, Bill. Your handle on Instagram is Where's Bill? So I think we should update our audience where you've been the last 2 weeks before we get into the podcast, because you've been on a pretty cool trip.
We went down and we have an off-road Sprinter van, and we actually remoted ourselves. I mean, we got real remote in southern Utah, and that's the way we spent Thanksgiving. Now, I got to tell you, we had a blast. It was phenomenal. We parked way out in the Canyonlands, all by ourselves. Didn't see anybody for a few days, but I really miss the family and friends of the holidays, and I'm going to really miss it on Christmas also. I mean, I can't imagine not spending, holidays with family and friends, but we are just not going to travel and do all the things we have to do right now, so that can happen. But I am now in Eagle, Idaho, so our Meridian this minute. But glad to be.
Welcome back. All right. With that, we're going to introduce Tina Upson, the executive director of Crush The Curve Idaho. And I'll give a little brief introduction of Tina, and then we've got a lot to talk about today, Tina. So last spring, Bill and I and another group of CEOs got together and just said, how can we be part of the solution? Business had to play a role in this. How do we help and kind of do our part? And as we got rolling, we realized that we needed someone full time to really dig into this and try to take it to the next level, if you will. I'll tell you, when I first brought up the idea of Tina Upson, I knew she was kind of maybe between things and kind of grounded a bit from her international career as a tech. Kind of a techie behind the scenes, making a difference for her companies. And I thought, well, let's ask her to see if we could get her for a few months. And I think really, Bill, we talked about this. We knew that we had to automate in order to scale. Anything we did, we had to automate. And so although Tina may not have had a background in COVID like none of us did, or from healthcare for that matter, she did have a very impressive resume of going in and automating companies and turning them around with technology. And I thought, what a great fit. And I also know how tenacious she is. And I thought, if anything needs to happen right now, we need some tenacity. So Tina started last spring, and man, what a journey. I can't tell you how proud we are of the work you've done with your team and what a great relationship it is. So with that introduction, welcome to the show, Tina Upson from Crush The Curve Idaho.
Thank you guys for having me.
I got to tell you, Tommy, when she first came on, I was afraid of her. I'm telling you, she was intimidating. I remember making a comment. I was with you and Mike Boren, and we were standing out in the field south of McCall, and I made a comment about, and I didn't mean anything disrespectful, and I thought, man, that we've got a warrior princess on our hands here, or something like that. And I'm telling you, I know she has skills, and I know she has tenacity, but she does what she says she's going to do. She accomplishes a lot. And I think she's turned out to be one of my most favorite people that I've ever worked with. She is an incredible doer in all senses of the world, in the word. And I'm just glad that we're doing this with her today.
Well, Tina, if we're going to all be honest, though, I knew at the beginning, Bill, that maybe I wasn't your favorite person, and I even said to Tommy, I was like, I think I came in a little too much bull in a china shop and was ready to dig in, and I think I freaked everybody out, and I knew maybe you're one of those, so I was glad when I realized we turned that corner and I'd earned your confidence for sure. It meant a lot.
You're my favorite person now. I like you so much better than Tommy Alquist. It's unbelievable.
There you go.
Truth. Hashtag truth. Hey, listen, before we start talking about Crush the Curve, though, Tina, tell us a little bit about you. Grew up here in Idaho, and then mother of some amazing children.
Yep.
And but an Idaho girl, and then you really your business career has been in technology, specifically automating companies, making them leaner, making the product scalable so that they could grow. Tell us a little bit about your family, a little bit about your history before we get into Crush the Curve.
Yeah, absolutely. Idaho girl, born and raised, took about a 5-year hiatus when I was first married, living in Arizona with my husband, came back here to really start his company and get those things moving. I grew up as the oldest of 6 kids. And when I first kind of rose through the business ranks, if you would, people would say, wow, where did you get your education from? How did you learn how to lead teams? And I was just like, I ran that house like a top. I'll tell you what, if I had a task that I had been given or a chore, not only did my siblings do the chore, they loved doing it. They thought it was a pleasure to do it. So I really learned a lot of skills, honestly, in the home and with a large family. I'm blessed to have 4 daughters of my own. And that's an adventure, that is just amazing for anybody who can relate to having children. It's just every phase is just an awesome journey. When it comes to taking technology and automating and making things leaner, for me, it's just a way to really stretch the bandwidth of a team, to support the bandwidth of a team, and then, really just take advantage of what's already known and out there that allows for us to be able to accomplish outcomes at scale. And so, it's definitely something I'm passionate about. Software as a service is a passion of mine. I love the opportunity that comes with a SaaS or software as a service offering, where you make an investment, a large investment, you build something one time, and then you can have an infinite amount of revenue kick off of it that isn't, without a variable expense going with it. And to me, that's always very, very exciting. And it, creates some really incredible opportunities, some of which some of our board members at Crush the Curve have experienced by building those types of entities. So, that's kind of me in a nutshell, I guess.
That's awesome. One more question, and then Bill, I'm going to shut up for a minute. One of the things about you is, so we have this board that really got together, Bill, and said, hey, we're gonna really make a difference. And I think everyone got committed. It's been, quite honestly, 2020 will be remembered for a lot of things for me personally, but the friendships we've developed on that board going through this year has just been incredible. And then we bring you, Tina, in, and I want to ask this question because I don't know that I listen. In medicine, you're around a lot of great female leaders. You just are. The woman that ran our group for years, super strong leader. In the ER, the nursing staff, there's a lot of women in healthcare. And I've been around a lot of great women leaders in my life. And I respect the heck out of them. And it's part of that culture, right? And but one of the things about you when you came in to a pretty intimidating situation, you come in, you got Bill Whitaker, former CEO of Simplot, you got Mike Boren, just sold his company for $1 gazillion. You got Brad Wiskersian, right? You've got this board, Ken Oram and Courtney, and you came into this thing. And I guess what I would ask you before we get into COVID is what message would you have for women leaders out there? Because you command a room. You command a room. You're confident. You tell us about that, because I think that's one of the most impressive things about your leadership style. I agree with Bill. Sometimes it's like, oh my gosh, we don't know what we got a tiger by the tail here. But you're very confident. You're very self-confident. What advice would you give women that are in the workplace that may be a little bit intimidated by a situation like this?
Yeah, absolutely. The advice I do give, I do get asked questions by young or upcoming or other women in the workplace. I get asked questions about navigating in a man's world, or, what does that really look like? How does it feel when you sit at that table? My experience has not lent me to be insecure in those settings. Maybe I'm just the fortunate and the only one that is, but my experience in business has not been such that I have ever felt oppressed by or held back by men in the workplace. I have, and so I really encourage women to not start from that place of maybe like they think I'm less than because I'm a woman. They may think that, but I never walk into a room feeling or assuming that anybody feels that way. I think part of that comes from having a really great father growing up. Tom Luna is my dad, for those listening that may know him. I think it's a lot easier for a woman when you have a really incredible father figure that is very respectful to your mother and very respectful to you as a female. I never felt like gender played any role in the value I could bring to the room. It was an intimidating board to come into, to be honest. And a lot of people don't know this, but I never really even accepted the position. I don't know if I still have. Tommy just told everybody I was running it and looked me in the eye like, this means you're running it. And I'm not kidding when I say that. I was in yogas and did sun and yard work, and he talked me into coming over to the office, and then he just called everybody and said, she's running it. And, so I don't know if I've ever accepted, but, for me, it was a really great opportunity. Kent Oram from ICCU, I'm a fangirl. He was on the board, being able to be around Bill from, the CEO of Simple. I mean, these were just incredible business leaders. Typically for me to have the pay scale I've gotten accustomed to as an executive, I've had to work for out-of-state firms. I mean, that's a lot of times has happened. So for me, I was like, gosh, these are really incredible, brilliant business leaders that I get to now rub, elbows with. I never realized how long the project was going to be or like what it would evolve into. I mean, I don't think anybody did, but it's been a huge blessing. So I guess, overall, my advice, Tommy, would be to any female is to just not assume that you're looked down on because you're a female. My experience, good men value women. And so if you're in a room with good men, you're going to be valued. So that's how I felt.
Fantastic.
What I think is pretty interesting is I think your dad's afraid of you too.
Oh,
no,
man.
seriously. So just a real quick story, starting Crush the Curve. It was this, I remember we talked about, building the plane as we flew it. And I remember I was worried, I was concerned about the money, where the finances were coming from. And Tina looked at me one day and said, listen, we have to test people. We have to turn around tests quickly. And we're about saving lives and making sure that we keep people as safe as we possibly can. We will get to the financial stuff that you're worried about, Bill. And I'm going, okay, let's go do it. And that's really fantastic. And I'm telling you, it's done for all the right reasons. Tina has a value system and principles that is, all these things are done for all the right reasons. And we're talking about 7 by 24 because I can't tell you how many texts she gets from me at night. I have this group of people that I just text at night because it's the only time they really have time to talk to me. And except for Tommy, he goes to bed at 8. So.
Well,
hey, let's start with telling a little bit of the story when you came in. So early on, we knew in Idaho. Let's be honest, we're a little rural. We're not a big population center. We knew we'd have to kind of fight for what we got as a state for testing and processes. And so I think early on, this group of folks just said, hey, what can we do to help? And initially it was supplies, Tina. If you remember when you first started, we were all about the swabs, the culture medium, and the capacity for labs. And it was, how are we going to solve this problem? And I would say that the first month, we basically just acquired through contracts and relationships as many swabs and testing supplies as we could and PPE. And that was phase one. And then phase two is where I really want to get there today with you, because I remember a conversation with you early on. And with my background in medicine, I understand labs. I understand PCR. We went up, Bill, remember when we went up to the University of Washington? It was a great trip up to their lab, and we toured their lab. So I got all that. But what I didn't understand is, here is this person from another industry who came in and said, all of this is great, but we have to build a redundant system for testing that doesn't rely on one lab and that eliminates all of the traditional barriers to quick turnaround. And we're going to do that through technology. And now that I've seen you've built it, but looking back to then, I was shaking my head like I get it, but I didn't get it. Talk us through how you build a system that right now, I don't know how many tests we're doing a day now, but it's a lot. And our trailing 24-hour turnaround time is excellent. But talk about what went through your mind and how you built the Crush the Curve Idaho program and platform.
Yeah, absolutely. I'd love to. And I think, from a from a key metric to talk about, I was looking today on the governor's website, Idahoans, 494,000 have been tested, right? Crush the Curve, without counting any of our medical partners, just Crush the Curve as an entity alone has facilitated and done the testing for almost 80,000 people now. That's almost 20%, almost 20% of the total number of tests in the state of Idaho have been done by Crush the Curve. And when you think about what that means, and I'm going to talk about how we got there from a scalable perspective, it really, that to me is unbelievable, right? And I think about, what would this look like without all of that? So when we started in supplies, right, it was exactly what you said, Tommy. That was the main thing that was stopping testing. I think the most frustrating thing that I've learned that I think the history books will outline as a fatal flaw to how we managed COVID was we always have, and we still do, if you really listen to people talk, we look at the total number of cases as a metric for what's going on with the virus. And it is completely flawed. It was never going to work. And it was done nationally, globally. I don't want to blame one state or leader or whatever. It was the wrong metric from the get-go, because if we were testing everybody every day, it was the perfect metric. So we've never even gotten to a level that experts would say we should be at for surveilling. So when you hear people talk in the community right now, and I love some of the people that do this. They will tell me, oh man, 1,500 positives today, and they want to talk about it. And I'm like, it's a skewed metric, and it always was. And I'll give you an example. When you guys first brought me in, a lot of what we did was secure supplies, and then honestly call even large hospital chains around the state and say, what do you need to be able to actually test? And I think at the time, guys, it was essential workers, right? It was first responders, healthcare workers. That was all we tried to see, is what is needed to actually test them. And we would send supplies out. I remember talking to a large hospital chain in eastern Idaho. They had 14 test kits in their possession. 14 people could they test, and they would be out of supplies. But yet their area, right, was sitting every night and watching the news to see how many cases were in their county. It was never going to work, that metric. So it still bugs me. It still bugs me that we look at that metric. The unfortunate thing is the only metric you could then, if someone wants to say, well, fine, Tina, what metric? The only one you could watch is hospital capacity. And unfortunately, that's a very trailing indicator of what's going on in a community. And once it's at a level, right, it's just too late. So it's just always been this thing that's kind of driven me crazy. So when we first came about, we moved away from supplies. Crush the Curve started figuring out a way to test a little bit better at scale and had some community testing. We had an experience in July when we saw everything swell, where we were really tightly tech-enabled with a single high throughput lab. And that we got a call on, let's call it a Wednesday morning, that said, don't send anything else today. If you do, we can't put it on the machine till next week. Our governor's commandeered the majority of our capacity, and we had a machine go down. Well, I have testing sites running all over the valley. We have test kits being collected. Fortunately, we were on a tech platform, and we made calls, and we connected same day to another lab, put a different FedEx label on that box, and sent it off. But what I realized in that moment, and that's just kind of that part I think, Tommy, you're leading to on lab capacity, was like, we never again are we going to go to and expect things to look different and be dependent on a lab. And at that time, that's when I said, I want at least 8 labs. I want to be able to do at all times 10 times more than the capacity we're doing currently. And anytime we get under that 10 times amount, then we add another lab. And by taking that approach, it also gave us a lot of flexibility and benefits we didn't realize, like the ability to quickly divert the traffic of those test kits to a lab because of resulting time, and almost create a competitive environment with labs. So it was a really strategic move that we made at Crush, that it really made it so that when things would swell, we didn't kind of fall into the things that we've seen, maybe other entities that are bound by red tape and can't make those really quick decisions. They still go to the large labs, right? Even if right now LabCorp, I'm not saying they are right now, I don't know what they're at. Let's say they're at 10 days. A lot of large hospital chains are still going to send over there. They didn't add anybody else. They didn't create a way to react to that. So that was an earlier move that we made in July when that swell hit, where we decided not to be beholden and added more labs. And what that really did, honestly, was when I think about testing, I always talk about it as a stool. Supplies, you have to have them. Lab capacity is the other leg of the stool. So we got 2 of our 3 legs. The third leg, and the only one I think that and I know for sure because we get a lot of national attention from other groups for it, that Crush solved for very well, was the collection leg of the stool, which is if you have all the supplies you could possibly need, your lab capacity is not an issue, your turnaround time is perfect. How do you swab enough nose to genuinely keep the virus at bay? How do you do that? How do you do that, especially in a today, December 8th, when all the hospitals and urgent cares and all the people that swab noses are overrun, right? And so what Crush did is it said, hey, we need to get those people out of it. We need to figure out a way that we could do collections and take advantage of the lab capacity that we've solved for and the supply issue that we solved for. And that's what's allowed Crush to have the volumes of testing we've been able to do. And that's what honestly has allowed for us to really be able to help save lives.
So Tina, talk a little bit about how you go about the process of determining which labs to use, because almost on a day-to-day basis, you have a decision to make, where the samples go, what labs you use, and you have some type of a software or prioritization software or decision tree that you go through. Can you talk about that? Yeah,
absolutely. So we call it like a lab listener. For all intents and purposes, it's gotten very simple with supplies. It used to be that we would have the algorithm was more complex. It would say these labs can take only these types of transport mediums, like these types of fluids that go with the actual swab. And so we'd have to pay attention. What supplies does somebody have as part of the selection of what labs to move traffic to? Now almost everybody takes pretty universal transport mediums. Like almost all of our labs all can take the same kits. That has simplified everything, because then all we have to do is say, hey, don't overrun a lab. So if a lab tells us, we like to try to use local labs as an example. Local labs, they're not high throughput yet, so they could take from us 500 a day. I don't want to send them 1,000 because I'm going to mess up their turnaround time and wreck all these other things. So the lab listener allows us to say, hey, after we hit 500, the next person that wants a shipping label, and we're about to move, this nursing home with 200 people that just tested today, when they request the shipping label, it's automatically going to select a different lab so that we don't continue to overrun the local lab. So it's an example. If we had a lab situation like July where a lab said, don't send to us, we have a way to inactivate that lab until they say they're back online. And so it's very seamless to the end user. If I'm a long-term care facility or one of the 20 school districts using us for testing, it's really at the point when they say, hey, I'm ready to ship my samples, that they may look at the label and go, oh, it's going to Bellevue today instead of Spokane, or, oh, it's going to Memphis today instead of New Jersey. Oh, it's going to Boise. That's cool. I didn't know we had a local lab. So they don't really care, right? They're doing the testing. They have the supplies, and the shipping label dictates where it's going to go. And the shipping label matches the lab that's now going to have digital orders waiting for the kits as they arrive.
Right. So one thing to keep in mind that I think it's important, we remind ourselves here a lot, we are a not-for-profit organization, Crush the Curve is. And trying to, so not-for-profit, we're running it with a skeleton crew. I mean, we have Tina, and I'm assuming about 3 part-time people or 3 or 4 part-time people. Would that be about right? Or
I mean, we've grown a little bit. We definitely have grown a little bit, and a lot of that, it's not for people that plan on working here for all of time, but we're able to secure some state contracts, like the long-term care one I'm talking about, et cetera. Right. So we were able to bring on, we're probably at 5 full-time, 5, 6 full-time, and then we've got some fractional help that helps around the edges and kind of scales up. It's skeleton compared to the work we do, but we're definitely running a little bit, larger than we did historically. But the output they do is great. They're incredible, and they're totally bought into the cause, which I love.
Yeah, the efficiency is, literally off the chart. And when we talk about non-for-profit, literally we do not, there's an administrative fee, but everything's done cost plus type basis. There's no profit in this. It's a matter of serving a community and serving a region for our state.
Yeah. Hey, Tina, before we leave this, I'm going to try to do a really good job of just summarizing what you just said, because I just think it's so important. So we've tested 80,000 people with what we started with you and a couple of part-time people up to now 5 full-time people. If you stacked up how many people we've tested with the efficiency we've tested them with these other organizations, I'm just really proud of what you've done. And people have said, well, how does it do it? I would say, I'm not smart enough to describe the software like you did, but I would say what we did is we we rely on self-collection, right? So it's either self-collection by the patient or by a nurse in a nursing home or by a school nurse in the school districts we cover. And then we've taken everything else out of the middle, and they have the supply, they have the labeled tube, the tube goes to a lab. They don't know where it's going because your software decides capacity, and then those results come straight back to them. It's genius what you've done. Talk to me a little bit about, we've been asked by multiple states to help them set up a similar structure. And I think that's kind of gone unnoticed too. But I know you've worked with the state of Tennessee, North Dakota, Arizona, Texas, lots of bigger states that have come to us and said, hey, how on earth are you doing this? Can you help us? And I know you've been very helpful to those regional, those other states too. Talk a little bit about that.
Yeah, absolutely. I mean, it has been a blessing to be able to come alongside of some of those different states and just see what they're working on and where they're at. I think a lot of times for me, I can be impatient. I think we should be further and have done more. And then I get on the phone sometimes with other organizations and they haven't even really gotten started. I mean, quite frankly, that's what it feels like. So I'm like, all right, I think we're doing okay. I think that it could be worse. But I think the main thing that has really been eye-opening for me is their desire to have a group like Crush the Curve. I mean, that almost always comes up from like the policy people in the governor's office for some of these states is like, where did you guys come from? And like, how do we get our hands on, how do we get maybe business leaders to care at the level that this group did to actually, put their own money on the line, their own reputations on the line and tackle something like this? I think that's the thing that, has stood out to me and kept me humble and recognizing, just how grateful I am for the founding board that they were like, let's do something. And, we'll get our own checkbooks out and this may or may not work, but we're not going to sit on the sidelines. I just think it goes to speak to Idaho in general and what an amazing place Idaho is. And I know that that's where the conversation started when I came on board was, listen, we don't have that many people that live in the state, right? I mean, I think LA Unified School District has more students than our entire state has population. So it feels like we got a lot of open air. We got a lot of really good people. And, we should be able to get this under control. Whether or not it's under control, I mean, I would say it's not under control. But I mean, we did tackle it. We're fighting the fight. We're doing all we can do. But, I think, Tommy, to answer your question, it's been great to talk to other states. It's been great to share what we learned, give them the playbook. There's no secrets here. We're not trying to hide some secret sauce of how we got something done. They want to open community testing sites. We forward over all the playbooks on how we stand it up, all the printables. I mean, we're not trying to keep it hostage, that's for sure.
That's great.
What still amazes me, the way this started, literally started virtually. And I think we were somewhat frustrated at the beginning of Crush the Curve. I think we wanted to move quicker. We wanted to make more things happen. We started off with antibody testing to take inventory and make sure we knew where we were in the state. And but if you think about the way Crush the Curve started, it started with a group that got together and said, we think we can make a difference. Tommy was the impetus and the original energy, and most of the energy around the board. But we did it virtually. And then here comes Tina, and we had Tina that made all she made everything work on a day-to-day basis and actually put the strategy together. So it's an important deal. Hey, you guys, do you mind if I change the subject?
Change it.
Okay, I'm going to change the subject. Listen, both of you have had COVID, and I'd like to talk about that just a little bit. I now have literally a couple dozen friends of mine that have had it. I'm staying really far away from them. These two have gone through it, and they're way past it, and they think they're pretty cute because they think they don't need to be vaccinated for a few months, and they're both too young to be vaccinated very quickly. But the point is tell us a little bit about, Tommy, start with us. Tell us a little bit about what it's like to all of a sudden go, oh, I'm positive. What's that feeling?
So a little bit of background for me. So I've had heart problems the last 2 years, had open heart surgery, and then had a big heart event this summer. So I was really worried for myself. And then we have our littlest daughter we adopted, and she's amazing, but she has bad lungs. She has a disease called eosinophilic bronchiectasis. And anytime she gets a cold, she ends up in the hospital. She's had a bronchoscopy multiple times. So we're freaked out about this, right? And then we're trying to balance their teenagers, right? Going to school, around friends. I mean, school's happening, and thinking, and my doctor, Dr. Poignet, my longtime internal medicine doctor, said, I don't know how you're going to do this because you live with viral vectors. As good as you want to be and Shannon want to be, every day that little viral vector comes through the door and one of them can't get sick. So, the first thing I would admit is we tried hard to stay safe as a family. And then we ended up getting it from a friend of one of my daughters, which is no fault of hers. She got it from a group of friends and it came through our door. And boy, when you get it, Bill, the first thing you think is it's this letdown, like, after all this time, I got it. And then there's some shame of, okay, I've got it now. Did I infect anyone? And you know what, Bill? It turns out, I'm ashamed to say this, but I'm going to admit it today on our podcast. I gave it to my father that's in his 70s. I was in a room with him for probably 15 minutes with masks on, and that's the only exposure he could have had. It was after I had tested negative, before I tested positive on a Saturday. So there's a good example for people out there that are, there's a lot of people saying, well, if I got a negative test or this isn't that big of a deal. I gave it to him in a short amount of time, in a short window that we had. Thank heavens he's doing well. He's a very healthy 74-year-old guy, and he's doing well, but it's infectious. And then I'll tell you about the illness, because I had a lot of similar symptoms that Tina had. I was sick. I was sick, laying in bed thinking, oh my gosh, what do I do? I've got a fever. I felt like every joint was full of glass. I had a horrible headache, and I just thought, I just was laying there praying. I was praying to God that it wouldn't go to my lungs and my heart, because I thought, what am I going to do? And I'm taking vitamins, I'm drinking fluids, but I was as scared as I've ever been because of my risk factors. And at the same time, my wife and my two daughters tested positive, so I was really worried about them too. So and then it's been a long recovery. I was done with the acute illness a few weeks ago, but it wasn't until this week that I feel normal again. And Tina, I'll let you tell your experience, but you do not want to get this.
Yeah, I would agree. I think my experience is a little bit different. We do proactive testing at Crush every 10 days. We all get screened. So, it was a normal Tuesday test for me, or Monday. Yeah, Tuesday test. Wednesday evening, I've got a car full of teenagers for my youth group that I lead. And I get I'm the admin on the Crush the Curve employee account, and then I'm a Crush the Curve employee. I got an alert, somebody in your org is positive, please log in to view. And I got an alert, your results are ready to be viewed. And I thought, oh snap. So I opened my result, and sure enough, I'm positive. And I just turned to the car and started taking all these cute girls back to church to get them out of my car. And then I had to call their parents. And, the only thing I can equate it to is, I felt like, because I had this happen once in my home with 4 daughters a few years back. It felt like when head lice came through, man, I was mortified. Like I needed to tell people, hey, sorry, I might have given this to you guys. Like it was just making those calls. And, I was fortunate because my symptom onset didn't happen for a couple of days. So I made different decisions between that positive test and actually starting to feel sick, when a normal individual in our community would have thought, I should get COVID tested. I don't feel good. I was able to make very different decisions in my daily activities and isolate in place and be able to do that. So that's a huge benefit, right? Of being able to have access to testing and fast result times. So I was able to take advantage of that. And then I had the same thing as Tommy, just very, very painful body aches. That would probably be the thing. The headache and the body aches were horrible. And I had some post-COVID symptoms that really surprised me, some insomnia and some brain fog that I was really glad when that let up. It was probably a good 10 days of that. So, for me, nobody in my family tested positive nor had symptoms. We tested them 3 times. So that was very different, than Tommy's experience of the whole family getting it. So it's just a very interesting virus, right? It's just, I can't say why my family didn't get it and Tommy's did get it. People always want to understand every piece, and we just need a lot more data and history before we can answer any questions about this, virus in that way. So, I think that's the big struggle. We saw a ton of testing swell right before Thanksgiving. The intent is great. The intent is test, and then I can go be with my family, even though the governor and everybody else says I shouldn't. I don't want to disrespect people wanting to be around family. It's been a lot of not being able to, but, to that end it's a point in time test. Your safest bet is going to be, until we can get some protection for those that are most vulnerable, to just really limit those types of activities. And it bums me out to say that.
As we're coming towards the end of this, I do want to get to two things that are really important for me and Bill to talk today about. But the first one is we're kind of in this unique spot, Bill, where, we're going to talk to Jim Souza too today, but we're kind of in this unique spot in life where we've gone through Thanksgiving. We know what hospital capacity is doing. Kind of, the cows are out of the barn here. They're loose. And we're just trying to mitigate now. And there's still definitely a role for testing. There's still a role for that side of it. But my goodness, I would plead with anyone that's listening today, that the wearing of a mask and trying to respect the social distancing guidelines that have been requested. If you want to be a good neighbor, if you want to be a good friend, if you want to be a good family member, look at me as a bad example, I guess, where I was exposed. I was exposed enough to be tested, and you do not want to infect someone. You want to take precautions to make sure that you're doing all you can to be a good citizen and part of the solution. And now it's probably more important than ever with hospital capacity where it is. So, Bill, any more to say about that, and Tina, on just recommendations as we sit here on December 8th?
Yeah, honestly, it troubles me in a pretty significant way to think that we can't make that sacrifice for each other to wear masks. Now, I can tell you, I will every once in a while catch myself walking across the parking lot into a retail store and go, oh, my mask. I keep one in my pocket all the time. I want to get the mask thing super right. I don't want to miss on the mask situation. But if we're not willing to do this for each other in a kind of a mutual show of respect for each other, I can't imagine I can't imagine when we really need something and really need somebody, how we could miss as a society in a pretty significant way. So, Tina, you're around it all the time. You have, literally hundreds and thousands of people coming through here to be tested. Yeah. And some of these people are scared. They have a look in their eye that they're scared because they have the symptoms or they've been around somebody. And I don't want to see that look in anybody's eye. I want to make sure that we do masks to the best of our ability.
Yeah.
Do I think we need to mandate masks? I don't know. We can debate the mandate masks all day long. I think what we need to do is just say, listen, they're that important. So, but go ahead. I'm sorry I interrupted.
No, my thing with masks, I think that has been the most frustrating for me is because of the great state we live in, and the people move here because they say like Idaho kind, you know what I mean? Like they want to be around the people. I have been very surprised by people not willing to wear a mask. And I think, and the arguments for why they don't want to wear a mask, for me, let's say that all their arguments are true. Let's say it's all just a big hoax and we're sheep and all the things. I'm fine if some evil person wanted to prank me and I stood on the side of like, hey, I thought this might save an elderly person's life, so I did it anyways. I'm fine standing in that light, and they can stay where they're at. But if they're wrong, which we know they're wrong, science says they're wrong, and it's their heart of hearts, and if they want to pray to God, he'll tell them they're wrong, they need to wear a mask. So for me, that has been extremely frustrating. I know because of the work that we do at Crush and then the calls we take. We have 300 long-term care facilities that utilize our program. These people are literally dying regularly, right? Regularly with these organizations we work for, and they're dying alone, and the heartbreak and the concern. And I got to hear about somebody thinking that it's an infringement of their rights to just put a piece of cloth on their face. It's a disappointment. I wouldn't have expected it from Idahoans. I'm not impressed. And I don't know if they just have no idea of what's going on around them. It has been very frustrating from my seat and watching just kind of the purview of people's reasons to not wear a mask has been very baffling to me.
I agree.
So, Tina, just a quick question. Tommy, we might have lost your visual, but I'm not sure. But listen, what do you think Crush the Curve looks like in the next 3 months, 6 months, and even a year. I mean, where do you see testing and our involvement with what's Crush the Curve's role as we evolve through vaccination?
Yeah. I mean, I think, my first answer would be Crush the Curve's role has always been to support whatever Idaho needs during this global pandemic. So whatever that need is, if there's a hand that we can lend to it, we're willing to do that. And hopefully that's not just words and we've earned enough credit in the bank with the powers that be to believe that now, right? So whether that is if there's any involvement in helping with the logistical side of vaccine management, I think there's a hyper focus in 2021 to figure out how to manage schools better. I would like to say that we can admit as a state that we messed up for semester number 1. What's the plan for semester number 2? I would like to know, because the vaccines are not going to be the game changer for this revolving door of quarantining children, some of which don't even have food to eat when they don't go to school, let alone aren't getting educated. So what I could see, and I know this because the tech that we license is also licensed by, for example, state of Massachusetts to do all of its school testing, is that we have access to protocols being used and put into place for heavy return to school efforts nationwide starting in January. I think Crush could play a really significant role there, and we have been in talks for some time. I mean, again, though, Bill, I think the short answer is whatever Idaho needs. We've proven that there's nothing beneath us. Do they need, is it supplies? Is it logistics? Is it actual, is it testing? What is it? I think we've proven that we can add value in whatever arena the state needs in regards to this pandemic.
Yeah. So then the question that goes with that, will Crush the Curve exist a year from now? And will we have a role to play a year from now?
I think that's an interesting question. I really struggle thinking about the school. I kind of go back to the head life statement in a little bit of a different way, is that I don't know what it looks like at schools when it comes to COVID now, right? Is it kind of like how we have a head lice policy at school of like, oh, this is the thing, and then this is the protocol for it? Is there still a testing arm to that? Are we truly expecting to force vaccinations or intend for vaccinations to be happening against all children? I just don't know. I think the school question mark is probably where, yes, a year from now, I think we need to see a comprehensive plan on how we're supposed to keep schools open and do the constitutional duty of educating Idaho's children. I do think that's going to have an element to it that's going to need something that's scalable, something that doesn't weigh on existing healthcare systems and public health systems, and Crush knows how to do that. So yes, I absolutely believe that the fall when school opens back up could and should look completely different than this last fall, but also still I do believe has a COVID element to understanding it. The virus is not gone 1 year from today.
No, exactly. No,
that's a great point. And then we gotta wrap up here, but I do want to. We're out of time, but I want to have one last thing. We don't know how the vaccine is going to roll out. 2 big unknowns in Idaho. One is will it be accepted by most Idahoans? Will people get vaccinated? I think our message today, Bill and Tina, to everyone listening to this podcast is please get vaccinated as soon as you can and encourage your loved ones and family to get vaccinated, be part of the solution that way. But we don't know how many people will get vaccinated, and that will determine a lot of what happens this next year. And then secondly, let's assume that you're going to have a lot of people that want to be vaccinated. Traditional healthcare systems are pretty clunky for cranking through a lot of people. And we've got almost 1.8 million people in the state, and you need 2 doses. That's going to take a while. It's going to need something that's scalable, that kind of like the software that you created, Tina, that connects lab capacity with swabs. We're going to kind of need something similar in Idaho to get people vaccinated quickly. So hopefully we can work with the state and we can be part of the solution. I loved your answer. Whatever they need, there's nothing beneath us. I think that servant mindset and just being part of the solution, I think that will be the hallmark of Crush the Curve forever. I've had a lot of people that, you've been so busy doing things. Some people have said, well, did Crush the Curve go away? And I think, oh my goodness, we have over 600 businesses that use us. We have, over 300 long-term care facilities. We have over 20 school districts, and we've got 5 full-time employees that are literally working 12 hours a day. So I'm really proud of you. Thank you for what you've done. I will tell you, we couldn't have done any of this, nothing without you. And and for me and Bill, I know Bill feels this way, and Bill, you can comment too. When we're even older and more gray, Bill, we will look back in fondness for what we did this year during this pandemic. Because for me, part of that initial meeting, Bill, is we were just felt paralyzed. What can we do to help? And at least we feel like we've been in the game. There's so many people complaining and moaning about everything going on. And there's so many experts, right? You just get online and everywhere you look, there's an expert. But in the middle of all that complaining, we were able to do something. And I appreciate you, Tina. I've learned so much from you. Could never tell you thanks enough for what you've done for the people of Idaho, and you have saved lives. So, Bill, anything to add to that?
No, I feel the same way. In fact, for all pride, I am really, really proud of Crush the Curve and what we've accomplished. And I'm really pleased and I don't want to be paternalistic and say I'm proud of you, Tina. You are an asset to Crush the Curve and one of my most respected people. And so I'm really glad to have you. And like I said, with us, and I really do believe this, you are our leader in so many different ways, and it's just great that we're all together.
Oh, I really appreciate that.
I'm glad that Inspire Excellence got to have you, and we got to talk about Crush the Curve today.
I appreciate that. I do tell Tommy all the time, one thing that we don't take enough time to do, and maybe my team needs it a little more, is pat ourselves on the back. We kind of just, help out this homeless shelter or just go racing in and help people. And we forget to put it on Facebook. But I do believe that our fingerprints are seen all over the community, and you will hear nothing but positive. I know that our team has put a lot of their heart into all of this work, and we really believe in the work that we've done. So I appreciate the opportunity to be able to take it to that place. So I thank both of you.
Good.
Hey, well, bless you. Thank you for joining us today. And for everyone listening out there to Inspire Excellence, join us every couple of weeks where we'll have a great story. Tina, a great Idaho story here, and being able to serve the people of Idaho. Thank you. And join us next time on Inspire Excellence.
Thanks, guys.
Thanks.
You've been listening to the Inspire Excellence podcast. We hope you've heard something today that will inspire you to make a difference in the world. Join us again for our next episode.